Good morning. I'm joined on the phone today by Dr. Hilda Hutcherson. She's currently an assistant professor of obstetrics and gynecology at Columbia University Medical Center. She's also the co-director of the New York Center for Women's Sexual Health. And here in the studio, attorney Lisa Martinez. She volunteers as the executive director of the Cincinnati-based Women's Sexual Health Foundation. She's also a registered nurse. Good morning to both of you.
Good morning.
Good morning.
I thought we should start out, Lisa, if you would, talking about what the Women's Sexual Health Foundation is.
Well, essentially, we're an international nonprofit foundation, and our primary mission is to educate the public and healthcare providers on medical conditions that may impact a woman's sexual health.
So, and it's been around, your organization's been around for how long?
About 3 years.
And Dr. Hutcherson, you serve on the board, is that correct?
Yes, I do.
And tell me, how large a problem are women's sexual concerns, medical concerns?
I think that research has shown that over half of women do have sexual concerns and complaints that they feel interfere with their quality of life and they consider to be an important issue. So this is a very common problem.
One of the things that we notice, though, is you can nearly turn on the TV anytime and see an ad for Viagra, but you don't hear a lot about women's sexual concerns. Why do you think that is?
I like to answer that question. I think partially it's because women aren't really validated in this area of health. We're doing a survey currently at our foundation's website, and one of the questions that we ask is, how often has your healthcare provider during your annual exam asked you whether or not you're having a problem with your sexual health or sexual function? Well, this survey's been going on for over a year, and 7% of the respondents have answered always. So we're getting 93% of women who really aren't being asked these questions. So,
do the doctors ask the men?
I don't know. Dr. Hutcherson, maybe you could answer that question.
Well, I teach at Columbia University as a medical school, and I give a lecture to prepare medical students to ask these very important questions about women's sexuality and sexual health. And I can tell you that most of the medical students find it very difficult and somewhat embarrassing to talk about sexual issues with their patients. And we're not taught this in medical school very, very often. Certainly in my day, we didn't talk about sexual health and sexuality and talking to women about these very important issues. So I'm trying to change that, and many medical schools are doing the same.
But do you think it's any different for men? Do you think that men are more comfortable talking about it? I'm just trying to figure out why, or is it just because the drug Viagra has had so much publicity?
Well, I think the drug Viagra has opened the conversation in general, especially for men. I still think men are probably still embarrassed. But it really falls on the shoulders of healthcare providers to ask the questions, because research also shows that most people independently are not going to raise this topic with their physician, that once the physician asks the question, they'll feel very comfortable with it, and many times feel very relieved that the physician is talking about this topic with them.
I've also found that the doctors find it much easier to talk to men about their sexual problems because there is a pill. It's kind of an easy fix for many men who have sexual issues, but they find it very difficult to talk to women about their sexual problems or issues or concerns.
Is that because there isn't an easy fix?
There often is not an easy fix, but there are lots of things that we can do to help women. So this is something that women should not be embarrassed about bringing up with their doctors.
Well, let's talk about some of the medical conditions, and these are things that I thought of initially when I thought about medical conditions, and menopause came to mind and hysterectomies came to mind. Are those some of the first places that you look, or those times in your life when you may be experiencing some of these troubles?
Perhaps, but also there are even other conditions. There are pelvic pain conditions that women have, whether it's vulvodynia or vestibulitis. And probably most women have never heard of that topic. But I think it really runs the gamut in terms of potential problems. I think most public...
That's so very true. I'm sorry to interrupt, Lisa, but it's very true because almost any chronic medical problem that a woman has can affect their sex lives. And almost any medication that you take can affect your sex life. For instance, you go to the pharmacy and you just buy antihistamine. Even that can affect your sex life and your enjoyment of sex.
So you really need to be aware, then. Women need to really be aware of all the things that are going out there. So we're not only talking about women at that menopausal stage, but you're talking anywhere from young women to much older women.
Correct. Absolutely.
Absolutely.
So when a woman starts to notice that she has a problem, do you recommend she bring it up with her doctor? Is there a better place to go than the doctor at first?
Well, I think, you certainly should be bringing the topic up with your physician. If your physician's not bringing up the topic, certainly you should. Also, you can go to our website. We have many, many resources to educate women on how to talk to their physician about their concerns and to educate themselves further on asking the right questions. And we've also found, if your physician doesn't feel comfortable talking about this topic or perhaps hasn't had the education or training, it may be the time to find another physician, too. This should not be something that you give up on. This is part of who you are as a woman. It's a health issue. And you may have to pursue another specialist.
I agree. I have to agree with you 100%. Lisa, that women should look at this as a health issue. And your sexuality affects the way you feel about yourself emotionally, but it also affects your physical health. And therefore, there's no reason to be embarrassed, and you should feel that you deserve the best medical care. Therefore, when you see your physician, you should make sure that you ask all of the important questions.
What are some of those questions?
You wonder to ask your doctor, well, is there something that I can do to make my sex life better, to make my relationship with my partner better? Is it any possibility that the medication that I'm taking is affecting my sex life and the way I view myself as a woman? Those are really important questions to have with your doctor at the time of your visit.
Let's talk about menopause, if we can, for a minute, since that's something that every woman most likely will be going through. What should women expect at that time in their lives? Should they expect major changes in their sexual function?
I find that women who remain sexually active throughout the transition may not have a lot of complaints with their sexual functioning. However, many of us will notice some changes. For instance, vaginal dryness that causes pain, and often we don't realize that that's because of menopause. A decrease in desire, for instance, that can have a devastating effect on a relationship with your partner, may also be caused by the decreasing hormones that women have when they go through menopause. And because these are two issues that most physicians can help you with, it is important, again, to ask that question, is there something that I can do to make my sexual functioning better now that I'm going through menopause?
We've talked a lot about physical issues. Are there ever mental, psychological issues that can also cause some problems, and is that something that either of you deal with at all?
Well, I believe even if you have a physical condition, there may be some emotional components with that, because often this is an aspect of your life that impacts your relationship. And with the relationship, there can be emotional issues. Therefore, you have to look at this from a multidisciplinary approach and look at the physical and the emotional components and address both. But I'm going to defer to Dr. Hutchison concerning specific emotional conditions, too.
Yes, there are emotional conditions that can affect your sex life. For instance, anxiety and depression can really put a death nail in your sexual functioning. And the medications that we take for those conditions can also affect our sex lives. And often physicians will write a prescription for instance, an antidepressant for women who have PMS or they're going through menopause and having hot flashes, and never tell the woman that this can decrease your desire or eradicate your desire, but also affect your functioning and your enjoyment of sex. And so a woman with depression takes the medication, or a woman with PMS or having hot flashes, and their sex life comes to a halt without ever having that conversation with the doctor that this is something that might happen.
So the bottom line is be aware of the medicine you're taking. Read the small fine print about the side effects. I imagine some of that may be listed or no.
It depends on the medication. Sometimes it's listed. Sometimes it's listed in a manner that a layperson really wouldn't understand. So that's why at our website we try to describe these medications a little bit more fully in lay language so women have an understanding what medications may impact their sexual function, and then they can go back to their physician and say, since I started this medication, my desire for sex has just gone right down the tubes. Could it be the medication?
And women have to ask the doctor when they're writing the prescription, will this affect my sex life?
So don't be afraid to ask.
Don't be afraid to ask.
Thank you both so much for joining me this morning.
Thank you.
Thank you. It's a pleasure.
I've been talking with Dr. Hilda Hutcherson. She's currently an assistant professor of obstetrics and gynecology at Columbia University Medical Center. She's also the co-director of the New York Center for Women's Sexual Health. And attorney Lisa Martinez. She volunteers as the executive director of the Cincinnati-based Women's Sexual Health Foundation. She's also a registered nurse. For Cincinnati Edition, I'm Marianne Zalesnik.